Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's daily bulletin. As AIIMS Delhi struggles to recover from a massive ransomware attack, hackers are currently selling at least 1.5 lakh patients' data, records belonging to Tamil Nadu-based multi-speciality hospital called Sri Saran Medical Center for hundreds of dollars on the dark web, cybersecurity researchers revealed on Friday. The stolen database is advertised for $100, meaning that multiple copies of the database would be sold. For actors seeking to be the exclusive owner of the database, the price is raised to $300, and if the owner intends to resell the database, the quoted price is $400. The cyber attack came on the heels of the massive AIIMS ransomware attack that has crippled the nation's premier healthcare institution for days. The Enforcement Directorate has attached a Pulse Super Speciality Hospital, a diagnostic center, and two land parcels worth Rs 82.77 crore belonging to jailed Jharkhand IAS officer Pooja Singhal under the anti-money laundering law. The federal agency has issued a provisional order under the Prevention of Money Laundering Act. The frozen properties include the Pulse Super Speciality Hospital, a diagnostic center and imaging center in the same name, and two land parcels located in Ranchi. ED had initiated a money laundering investigations on the basis of multiple FIRs registered by Jharkhand Police and Vigilance Bureau Jharkhand. A patient with the Zika virus, which is mainly spread by mosquitoes, has been detected in Pune city. The patient is a 67-year-old man from Bhavdan. Currently, the patient is fully recovered and has no symptoms. Against this background, the health department has sped up fever patient service in Pune city and the Bhavdan area. Zika virus is a member of the virus family Flaviviridae. It is spread by daytime active Aedes mosquitoes such as A. aegypti and A. albopictus. Its name comes from the Zika forest of Uganda, where the virus was first isolated in 1947. The most common symptoms of Zika are fever, rash, headache, joint pain, red eyes, and muscle pain. Till now, there is no specific treatment for infection with the Zika virus. To help relieve symptoms, patients should get plenty of rest and drink plenty of fluids to prevent dehydration. The over-the-counter medication, Tylenol and others, may help relieve joint pain and fever.
Researchers at the Karolinska Institute in Sweden have conducted a pioneering study analyzing the internet-delivered anonymous cognitive behavioral therapy, that is the CBT program, for people who view images or videos of children being sexually abused. The participants, who were mainly recruited via forums on the encrypted part of the internet called the darknet, reported less use of such material after their therapy. The study that I'm talking about is published in the journal Internet Interventions. The spread of images and videos of children being sexually abused has been a widespread problem. Now, in 2021, almost 85 million files suspected to contain documented sexual abuse of children, legally referred to as child pornography, were reported to different tip lines around the world, an increase of about 30% from 2020. In a study using a first-of-its-kind mouse model of aging that mimics breast cancer development in estrogen receptor-positive postmenopausal women, investigators have determined that overexpression or switching on of the ESR1 gene could actually lead to the elevated risk of developing estrogen receptor-positive breast cancer in older women. In a second study from the same research lab, investigators found that in the specifically bred mice given anti-hormonal drugs similar to those currently used by the women to lower their breast cancer risk, the elevated risk of developing breast cancer due to the overexpression of the ESR1 could be lowered or even reversed. The findings that I'm talking about appeared in the American Journal of Pathology. The phase 3 trial results for lecanemab and gantenerumab presented at the clinical trials on Alzheimer's disease, that is the CTAD conference, demonstrated why optimal treatment of Alzheimer's will require drugs that do more than clear amyloid plaques. While lecanemab had an effect on slowing the cognitive decline and removing these amyloid plaques in the brain, gantenerumab had neither effect. This was a historic clinical trial on Alzheimer's disease conference reflecting tremendous progress in Alzheimer's research and drug development. There has been a lot of encouraging news, including the lecanemab results and clinical trial data from other classes of drugs as well, that demonstrate the diversity of the pipeline in this treatment. So the mixed data shows that while anti-amyloids are a promising starting point, however, there will be need for a combination of drugs aimed at different targets. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.